Good afternoon to you. Today, I want to talk about the treatments and technologies in acute trauma. And basically, my talk will focus on trauma in Victoria as our case study, in the sense that the data that has been collected in Victoria, Australia, regarding trauma has got a lot of educational value. And under this, we'll look at the following topics. Firstly, we'll look at trauma systems, and we'll also talk about Alfred experience. Alfred is a specific hospital in Alfred Town, and then also we'll talk about mechanisms of injury. Basically, there are various types of injuries that could result to trauma, and we'll look at technologies such as radiography technologies and management systems in trauma. We'll also look at prevention of trauma and also some trauma cases that stand out to just give more information. Firstly, you all know that trauma comes in various forms, and can be, for example, mechanical shock as a result of mechanical impact, and it can also be from electrical shock. Trauma also can be generated by chemicals within the body, or by taking toxic chemicals, for example drugs, etc. Also, trauma can be caused by heat. This is called thermal. And it can also be created or caused by kinetics. Kinetics basically as a result of movement. Movement, for example, falls. People fall quite a lot. Either they fall off their bike or fall off in the kitchen while walking, or in the road, wherever it is. And any trauma that is as a result of motion is called kinetic. And I believe that you all understand. Probably you may have experienced one of these kind of experiences, but really what is important is the injuries that are caused as a result of all these forces, the different forces that the body is exposed to. And what I've just outlined is the external forces that may cause trauma. And trauma is not a good experience at all. Although the degrees vary so much, it could be major trauma, it could be minor trauma, etc. But quite often it's a disturbing experience. One of the traumas that people can go through, besides external forces, could be probably due to loss of loved ones. There's a shock that people experienced, emotional shock that can bring trauma. Other people, they actually faint. Some people, they black out. But just to let you know that there are several types of traumas. And if you look at your life, just think about times when you've gone through extreme experiences that have resulted in injury of your body, resulting into bleeding, for example, broken bones and things like that. Now, one may ask, why are we mainly focusing on the trauma in Victoria, Australia? You know, Victoria is the state in Australia, and they have actually generated a lot of interesting data through their research on trauma. And this data is actually teaches us a lot about trauma systems. And this stands out to be a role model in terms of trauma studies. And one of the highlights out of Victoria is the fact that, you know, in 1999, basically there was an interesting report that is published, you know, that focused on death as a result of trauma. And also it focused on the high rate of preventable and potentially preventable death rates. Sorry. And out of this, they actually highlighted 3 major, you know, trauma centers in Victoria that helped to generate all this type of data. Now, if I may just quickly talk about these centers, because these are special medical centers that deal specifically in trauma cases. As you know, trauma cases usually are life-threatening cases that require special attention and rapid response by ambulance, paramedics, and all emergency staff in the hospital. And when you look at a trauma center, maybe let me just quickly just compare with South Africa. In South Africa, we have about 8, probably to 12 major hospitals. And out of these hospitals, only 5 of these hospitals have got major trauma centers. Meaning these are the only hospitals that can handle major trauma cases. And I'll talk about these cases later on and describe exactly what they are. So with the Victorian report, it showed that they received admission to an intensive care unit for more than 24 hours. So, for any trauma center to be considered as a trauma center, it must be able to receive intensive care, you know, admissions for intensive care. Intensive care, that is, people who are really deep, you know, seriously injured and life-threatening conditions for more than 24 hours with mechanical ventilation, which means they are not able to breathe by themselves, but they require, you know, additional ventilation. And also, these they handle serious injuries involving 2 to 3 more body parts, meaning patients who go to trauma centers might have serious injuries to their body involving 2 or more body parts. And also, if you look at the injury severity score, because in the medical field there's an injury severity score, it must be above 15. I'm not going to go deeper in that, but just for you to let you know that there are levels of injury severities. So, and also a major trauma center or criteria must have an agent surgery for intracranial, intrathoracic, and intra-abdominal injury, or for fixation of pelvic and spinal fractures. What does this mean? Must have a theater for agent surgery of the head injuries and injuries in the chest region of the body, or in the abdominal injury, or the pelvic area, or the spine fractures. These are important body parts. In the head, you have the brain, and the brain also within the head is connected to vital organs such as the eyes, ears, the mouth, etc. In the thoracic, you have the lungs, the heart, the liver, etc. These are important organs that needs to be attended to immediately. And also intra-abdominal injuries, also can be quite in the abdomen, where you have the intestines, etc. Or the fixation of pelvic. The pelvic region also is another critical part. The spinal fractures, very important. I'll talk more about the spinal fractures, because any slight, fracture or injury to the spine can have devastating consequences to the patient. And also, a major trauma center should be able to deal with cases that lead to death after injury. So this is one of the criteria of the major trauma center. Now, why are we focusing on Alfred Hospital? Okay, the data that we got from Alfred Hospital is that this is a hospital that receives about 15,500 trauma presentations to the emergency department per year. And out of these 1,450 major trauma cases are received in those major trauma centers. Per year. That simply tells you that, they have approximately 4 major trauma cases per day with simple arithmetic. That's quite a lot, because it means that you get about 4 patients of intensive care per day. Can you imagine the type of facilities you need to have in order to handle such a rate of hospitalization? It's quite huge and very demanding. And what it also means is that, in any trauma case, timing is very important. As such, the first hour, which is the initial 60 minutes of any trauma case, is very crucial. This is called the golden hour. Patients or any trauma victim needs to be attended to as quickly as possible within that first 60 minutes. And one important operation, or rather task, that needs to be done is the introduction of the cervical collar. The first thing that you do in a trauma case, in a major trauma case, is to introduce the cervical collar. Cervical collar, basically, this is a neck brace that protects the neck movement. I'll talk more about this also later. But this is very crucial. And also, you need to have radiological technologies that can facilitate, the determination or examination of trauma patients. These may include CT scan, MRI technologies. So these are important technologies that will help to determine how serious the injuries are. Now, it's important to note that, when you introduce a cervical collar, you do not need to know the state of the injury at all. This is a precautionary measure that is done by every case that you encounter because of the sensitivity of the neck region. Also, regarding the technological, facilities, you also need ultrasound scans for suspected abdominal trauma. And also, we need operative management. Basically, these are procedures that require, operating the trauma cases, doing the operation theater, for example, surgical theaters, etc. And the entire procedure from the time the patient is admitted into the trauma center up to the time the patient is released. And I'll talk more about this as well. It also involves, deep vein thrombosis prophylaxis. I'll talk more about the importance of blood clotting in the body during trauma cases. Time in hospital may last from hours to months within the trauma center. Okay, now before we go deep into the details about trauma cases and everything, it's important to understand how these trauma cases are brought about, because a lot of research has been done to determine the source of these trauma cases. And interestingly, it's been shown that the profile of cases vary between males and females. So, when you look at the females, the most critical cases or instances when females end up in a trauma situation is when there are passengers, either passengers in a car or in a bus or any form of transportation. The second is when they are actually driving, especially texting while driving. This has been shown to be quite high as a contributing factor to trauma cases. And thirdly, when they are pedestrians. Women, when they are pedestrians, usually they don't take care of their movements. So women out there, be careful. Take care of yourself when you're pedestrians. Now, if you look at the male drivers or male factors that lead to trauma cases, firstly is when males are drivers themselves. And always males will be on the driving seats. They like driving. And quite often they are involved in car accidents, road accidents, etc. as drivers. This is also followed by assaults. Men by nature are violent, and quite often they are involved in violent incidences that may lead to, assault cases, and this also can lead to trauma. Stabbings, very important, especially in South Africa. So, violence as a result of, for example, excessive alcohol intake, fights, resulting into injuries, serious injuries, concussions, etc., and also stabbings are very common. Now, this is just to show that actually this kind of data is important to help, prevent such kind of trauma instances in our communities. And if you look at this kind of data, it was collected to individuals between the years 18 to 21 years old. But again, age matters. If you look at beyond 21 years, the profile may change, or if you look at less than 18 years, that may change. Now, this is basically a graph to support what I said previously. The top 10 injury causes of major trauma in Australia, Victoria. And also the admissions of trauma centers, trauma cases in Victoria between 18 to 21 years. You can see between the female in light color and the males in green, indicating the dominance in these cases. For example, motor vehicle drivers. It's mainly males that are highly involved in such kind of trauma. So when you look at data like this, as a health specialist, you need to know how to address, preventative measures in the community, how you address these issues to males, how you educate the communities against, for example, drunk driving and, road safety rules. So the emphasis must be more on the males than females. Okay. And yeah, so basically such data tells you a lot of information on how to devise methods of prevention. Okay, now, quite often when people are involved in trauma situations, especially such as road car accidents, quite often they can be very, very sensitive, usually involving actually picking up patients from mangled cars, literally cutting the car parts off the car to access the patients who are trapped in the cars. And that you can see on this picture simply shows the seriousness of trauma cases involving cars. And in order to do this patient, most of the first aid practices will have to be done while the patient is in the car position, in that position, before you lift the patient up. And as I said earlier, the first thing you do is to introduce the cervical collar to secure the neck, and then you do other things later. Also important, which is also highly evident in Alfred Hospital, is air transport. Very important in trauma cases. In emergency cases, you need helicopter or air transport for rapid response. As you know, first hour is the golden hour. You need patients or victims to be retrieved from trauma sites and transported to the trauma centers within the first hour to save lives. So that's why it's important. And again, it's important to have operative, facilities, surgical facilities. Theaters are very important. Surgical theaters or theaters that require, sensitive handling of patients, involving all sorts of technologies for monitoring the patient, diagnosis, etc. You also need qualified staff to handle this. These are specialists that actually handle trauma cases. And the aim is basically to minimize mistakes and increasing the likelihood of saving lives. Okay, now let me quickly talk about the cervical collar. Cervical collar, as I said, this is a neck brace that is introduced and secured to the neck of the victim in a trauma case. And it's the first thing that is put before you do anything else to secure, because the neck connects the head, which is a very sensitive, part of the body comprising the brain. As you know, the brain actually, is like a computer of the body, processes all the information and sends it through the spinal cord to the rest of the body. And the neck connects the head, as you know. Now, this connection basically is enhanced by muscles and a few cervical vertebrae. In a trauma case where maybe there's external impact, because of the delicate nature of this region, these bones may move, may be fractured. So to avoid, yes, firstly, the rationale of cervical collar in any major trauma cases. Firstly, you assume that a spinal injury has occurred until proven otherwise. This is the assumption taken. This is why I said the first thing you do is to introduce a cervical collar. And also, cervical collar is applied at accident scene, not anywhere else. You don't have to wait. You have to apply immediately you arrive at the accident scene before you can actually transport this patient to the hospital. However, the cervical collar can be changed at the hospital after preliminary examination. And stabilization of cervical spine is the third rationale for introducing a cervical collar. You need to stabilize the cervical spine until investigation for primary injuries has completed. Let me explain this. The head is connected to the spinal cord. What is the spinal cord? The spinal cord is like, I'll just give an example. It's a soft tissue that connects the brain, goes down through the spine vertebrae. You notice if you eat, let's say, a neck of a chicken, if you eat along the spine, the vertebrae, you will notice in the middle of the vertebrae bones, there's a hole, and within there's a soft tissue, which is like a tube, consists of soft material, goes all the way down up to the tip of the, more or less like the tail of the chicken. That is spinal cord. That is a tissue or material that sends all, information from the brain to the rest of the body. The vertebrae is a protective material to protect the spinal cord injury or damage. Now, by introducing a cervical collar, actually you firstly want to stabilize the cervical spine until further, until investigations are done. Also prevent secondary injuries, because what will happen is that if you don't introduce the cervical collar, any movement on the neck may introduce secondary injuries, which can be fatal if you're not very careful. So to prevent that, introduce the cervical collar as quickly as possible to prevent secondary injuries. And also, the cervical collar allows for spinal precautions. There are many precautions that, relate to the spine. And I'm not going to go into details on that. And the aim also is that this introduction of spinal collar is one of the key procedures in the medical treatment of trauma cases. So, which means that there's a way of handling this spinal column, from the scene of accident to the hospital prior to discharge from the hospital, which is what is called spinal clearance process. So it's a step-by-step process that is done to ensure that the health of the patient is maintained and no chances are taken to avoid further injury. Now, also it's important to know that a spinal collar that is introduced at the site of the accident may remain or may be retained for maybe 2 weeks to probably 12 weeks to if indeed there is evidence of spinal injury. But it's important that the spine, the cervical collar may also introduce problems if left to on the neck for too long. Hence, there are inherent problems with the cervical collar. Quite often, the collar that is introduced at the site of accident is usually different from the long-term collar that is introduced in the hospital. After you have examined the patient, if there's serious injury to the neck, and the second collar is introduced, which is customized to the patient's condition to prevent these inherent problems of the collar. Okay, having said that, let me quickly highlight the importance of radiological technologies in dealing with major trauma issues. Of course, we have the X-ray. X-rays is one of the oldest, radiological method. If you are born at the time I was born, or the time I was brought up as a young man, you notice that at that time we didn't have CT scan, MRI technologies. Even the X-ray technology was not highly developed as it is today. We ought to thank the scientists for developing such kind of technology, such as CT scanners, which produce valuable information to help diagnose and treat patients. MRI scanners also are very valuable. Now, if you look at the X-ray scanning outcome, on the left you see the kind of scan outcome. Basically, you see the bone structures with a bit of flesh in gray, but you feel the dense white is at the bones. Yeah, from that scan you can tell where the fractures are, but this does not conclusively tell you the severity of the fractures. But if you use a CT scan basically is a computerized tomography. On the right you can see the outcome. Basically the CT scan shows you the bone outline. If there are any fractures, it will show you where the fractures. If there's any movement or dislocation of bones, it will show you exactly where this has occurred. Now, this can be taken in from various directions. For example, here we have the axial view taken, let's say, from above. It's like a cross-section view of the neck. So this is how it looks And if you take the side view called sagittal view, again, if you look at the outline of the bones, you can see between the bone structures there's a space there between the bigger bones and the left one, the bones on the left. That space in between, that's where the spinal cord passes through. Again, I gave you an example of a chicken bones. If you are eating the neck of chicken or the thoracic part of the chicken, you notice that those structures you notice in between those vertebrae there's a hole, and the spinal cord passes through there. So it's a protective, mechanism from any injury or any fractures, for any damage to the spinal cord, because it's very sensitive. Any damage, any dislocation will impair the nervous system, and it may result into paralysis and things like stroke, etc. Now, there's a 3D reconstruction that may result from the collection of the CT scans, images from various angles. You can put these images together and reconstruct what is called a 3D image. A 3D image will basically show you exactly where the fractures have occurred. And as you can see, those yellow arrows indicating where in this case, where this patient's fractured cervical spine occurred. Now you can see how valuable this information is, because it will show you the severity of the injury and what needs to be done. More images of the CT scan on the left compared to the MRI, magnetic resonance imaging. If you look at the MRI image, it also includes the tissue material. If you can see the spinal cord running through from the brain going down, surrounded by the vertebrae on the right. Also includes some skin tissue, muscle also. Now, this is very valuable information because it gives you a much more visual perception of what is really going on to the patient's body. Okay. Now, let's quickly look at how to manage spine injuries in major trauma cases. When you talk about management of the spine, basically it requires, it involves a number of examinations, evaluations, and decision making based on data collected. So, as a surgeon or as a medical practitioner, you need to make choices based on the information that you have collected. For example, from just physical examination using CT scan, X-rays, and MRI, that will help you to decide what kind of management practice you need to do. So there are choices to be done, and usually this must be based on evidence. Evidence as a result of your experience, or evidence as a result of what has worked from other surgeons, other health practitioners. This kind of information quite often is collected and published in journals, medical journals, etc. So it's important that you keep abreast with the research information that is published in journals, so that you can use that information also to make informed decisions. Okay, now let's look at the various choices that needs to be made when one is involved in cervical spine injury management. So, for very minor injury to the spine, quite often the collar is removed within 2 days or a couple of days after admitting to the trauma center. But For more serious injuries, this may require probably between 2 to 12 weeks of cervical collar and admission to the trauma center. And after that, you may require a rescanning of the patient. That is doing the CT scan and MRI scanning. Or you may actually require what we call a halothoracic brace, which means after rescanning, if there's evidence that the patient has internal injuries, they are injuries to the spinal bones, probably to the spinal cord as well, you may actually introduce what is called a halothoracic brace. You can see that halothoracic brace on the pictures below. Basically, these are metal braces that are inserted into the head. There are pins that are inserted into the cranial bone. You have the outer bone of the head and the inner bone, but these pins basically are introduced into the outer bone and held to these metal braces, and which is worn on the chest and which is actually fixed to the thoracic part of the head to avoid lateral movement of the head, and hence that will help, the healing process of the injury. Now, in case of more serious injuries, for example, if the patient is highly unstable, which means if you cannot use halo brace, and this person, for example, kids or people who are highly unstable, because of the risk of the spinal cord injury, you may actually have to operate them. So we have operation procedures, and introduce what they call fusion, spinal fusion. I'll talk about that later. I'll show you how that is done. Also, if there's evidence of spinal cord injury, you may actually require what they call early decompression. Okay, decompression, I'll talk about this. Compression, basically, as I said, the spinal cord passes through the vertebrae. If there's, for example, damage to the injury to the vertebrae, and some of the bone fragments actually end up piercing into the spinal cord, which means they are compressing the spinal cord. So you may require what is called early decompression to release those bones from the spinal cord. The spinal cord is not supposed to be compressed. It needs to be in a relaxed and fixed, position to allow all the physiological processes to happen without problems. And also, if there is indeed spinal cord injury, after the decompression and all those procedures, the patient may be sent to a spinal unit for rehabilitation. Yeah, this is a special, therapy that requires rehabilitating the patient in terms of movements and all those, practices. Okay, now I spoke about operation procedures in the major trauma centers. Firstly, must have operating theaters. Operating theaters are very important, because if you cannot conduct those early procedures and it requires major surgery or operations, you need a theater. What is the aim of a theater? Firstly, the aim is to control bleeding. Bleeding is a very important procedure. Controlling of bleeding is a very important procedure, as you know. If a patient loses blood excessively, may die. And bleeding must be controlled as quickly as possible. But you know, the bleeding is highly sensitive because it means that the body part has been open to the external environment, exposing the internal parts of the body to the external environment, and that may introduce infections, etc. And the loss of blood may result into losing the patient. Also, the operating theater aims to stabilize the fractures. Once fractures have been identified, they need to be stabilized, meaning they need to be fixed in a position so that they can start healing. Because the body has a healing mechanism of its own, but it requires these bones to be fixed in a stable position. So that's one of the aims of the theater, is to do such kind of practices and procedures rather. And also, the operating theater aims to address many other problems, which I cannot go through now. There are many problems that can result based on the type of accident and etc., which can only be done in the theater. Okay. Now, here, basically, as I said earlier, when surgery is required to treat a major injury, serious cervical injury, you may require what you call cervical spine fusion. Fusion basically is fusing two broken bones together. And if you know that there's unstable, movement, which means you need to bring these two broken bones together physically and immobilize them physically by introducing a fusion. For example, on the left picture, you have a single fusion. This is basically introduction of a plate in between, holding the two, and screws holding the two bones together. So there's a plate with screws on either side that holds the two bones together in a fixed position to allow healing to occur. Okay, there's a middle picture, basically it's a blown up picture just to indicate those screws and the plate. On the right is a picture showing multiple fusions. So it's the multiple fusions, meaning there's multiple injuries to the cervical bones. Okay, again, once the patient has been operated on, they need to be sent into an intensive ward, IC. Basically, this is a place where there's all the technologies, monitoring, computers, monitoring technologies, and computers that are able to actually introduce medication without the help of men, just by feeding information to the computer. It will introduce, for example, blood or saline, water or whatever medications without using human hand. And this is a picture of an intensive care unit. Very important. Okay. Now, having said that, let me quickly talk about the importance of bleeding. Yeah. What will happen is that if bleeding is not controlled, if bleeding is not treated properly, you may get what we call blood clotting in various parts of the body. You can get internal bleeding, or you can have external bleeding. Based on the nature of bleeding, you may end up getting what is called thrombosis. Thrombosis basically is the blood clotting in veins, especially when blood clots in deep veins can be very serious and life-threatening. So deep vein thrombosis is one of the major problems in trauma patients. You need to look for that and treat it very quickly, because during concussion, during trauma, such thrombosis can occur very readily. So we have, for example, on the right picture here, showing the position of the clot in the leg, deep vein thrombosis. It's important to realize that, you know, if you look at the veins, you have small veins which are close to the skin. But these veins later on join and into what we call deep veins in the muscles. In the deeper muscles, there are big veins which carry blood. And when you have clotting to those veins, it may lead to swelling of the legs or whatever part of the body, and blocking the movement of blood. So, again, when we talk about thrombosis, it's important to understand the causes of this thrombosis, because not all thrombosis may be caused as a result of trauma. Okay. Most of the common causes of this deep vein thrombosis is what we call venous stasis. Venous stasis basically is the blockage of veins. Yeah, stasis basically means blocking of movement of blood. Okay, but you can also get thrombosis, usually in less common cases, as a result of contraceptive therapy. Those who are on contraceptives, or if you experience malignancy, you know, a tumor that grows, you know, in the blocking the veins, may result into blood clotting because it restricts blood movement. And there are other cases, less common cases, that may cause thrombosis. Yeah, so it's important just to know that it's not always trauma cases that, or accidents or things like that, may result to thrombosis. Now, let's quickly look at trauma patients who are at risk, high risk of this deep vein thrombosis. Okay, how does this deep vein thrombosis occur in trauma patients who are at high risk? Okay, the first instance is where you have blood transfusions. Remember, blood transfusion is introducing external blood into the patient. That exercise sometimes may result into blood clotting. Or when you have prolonged surgical operations or procedures, and when it takes too long because blood movement is slowed down, and in certain parts of the body you may get blood clotting, or you may, as a result of major vessel repairs. So these are important surgical procedures, but sometimes they may introduce blood clots. So it's important to be aware of that. Also, you may get head, chest, you may get blood clotting in the head, in the chest, abdomen injuries, the spine fracture, lower limb fracture, pelvic fracture, or you may get what is called multi-trauma patients. Okay, you know, any blood clot in the head can be very dangerous, because the brain is actually a very sensitive organ, and quite often blood clot in the brain may result to stroke. hemorrhage. Brain hemorrhage is a very serious case and needs to be dealt with very urgently. Otherwise, the patient may lose the patient or may get permanent damage to the body, in the brain. Thrombosis in the chest may result, for example, in the lungs. These are very sensitive, organs due to probably some movement of substances from other parts of the body through the blood into the lung, obstructing the function of the lungs. You may also get within the big blood vessels that passes through the chest, close to going to the heart. Once those are blocked, you may get very serious health condition. Also, abdominal injuries that may result into various, thrombotic, scenarios. Okay, maybe let me just quickly mention here about multi-trauma patients. Multi-trauma patients basically here means trauma patients that have 2 or more fractures within their body. 2 or more fractures. And that may actually complicate their conditions much more. These are called multi-trauma patients. Okay, and having said that, again, if we look at the lungs, the lungs is a thoracic, is an important part of the body, consisting of the lungs, the heart, very important organs. And when you have thrombosis to those parts, the veins around that area, may result to very discomforting, feeling of the patients, or into death if not quickly attended to. You can actually experience what is called complications within the thoracic region. One of these is called pulmonary embolus. Pulmonary embolus is actually, pulmonary means lungs, and you may get thromboembolism. Pulmonary thromboembolism is also called pulmonary thromboembolism, which has shown, in 15 to 30% of deaths of trauma patients as a result of such complications that occur within the lung region, especially when it's not properly diagnosed because of the nature of the lungs. And sometimes, if not properly diagnosed, you get patients who die from such kind of thrombosis. However, there are other thrombosis within the body, quite often within other vessels within the body, which are less common. One of them is a case study of what is called idiopathic thrombosis or thromboembolism or thrombus. And this rare case, in fact, it's indicated here in this paper that was published in 2009, where they found an thrombosis in the internal jugular vein. Jugular vein is a very big vein, and in this rare case, in the young trauma patient, they found that actually this idiopathic thrombosis was as a result of inherited disease. It's a congenital problem. This is very rare, but as a medical practitioner, you need to be aware of such things, where they found that actually thrombosis that was occurring in this patient, even after tried in examining all the bone structures, the blood composition, and taking all those scans, it looked normal, but until they discovered that actually this patient has congenital embolithrombolism. And yeah, so that's one of the rare cases. Now, after having said that, now the next question is, how do you deal with a patient when you know there's thrombosis involved? In a major trauma, there are chemotherapeutics or drugs that are administered to patients. The first line of drugs is called enoxaparin. As you can see, it is from heparin. Heparin basically is anti-blood coagulant. And enoxaparin basically is at the rate of 4 milligram SC daily. SC there stands for subcutaneous injection daily. And hence the pictures down below there, one of the picture on the left indicating the injections, and on the right simply demonstrates how the subcutaneous injection is done. You can do that even by yourself if you are taught properly how to do it. You inject it to the subcutaneous level and allow the drug to go in, and yes, and once it goes in, it helps to thin or to melt the clots. So this enoxaparin basically is a low molecular weight heparin. It binds to antithrombin 2 in the coagulation pathway to inhibit clotting. So this is one, it's an inhibitor. It binds to this, and thrombin is a factor that basically that is involved in the coagulation. Remember, blood coagulation is a normal body physiological process. For example, if you cut yourself and there's bleeding, in order to heal that wound quickly, the site at which you have cut yourself, where the injury is, blood should be able to clot very quickly to prevent further bleeding and to also prevent infection. Once it clots, it blocks, it stops bleeding, and it also prevents prevents infection, prevents other contamination and things like that. And there's this antithrombin 3 factor which is responsible for that coagulation. But when you have this abnormal situation in an emergency and a major trauma, and you have blood clotting in the internal organs, so you administer enoxaparin as the first line drug to basically go and bind to this antithrombin 3 factor and stops the coagulation pathway, and hence allowing the blood to flow. If there are any clots, the clots basically melt. Yeah. This drug is contraindicated in active bleeding. People who are actively bleeding must not be given such a drug, because basically it will mean that they will not stop bleeding. They will bleed continuously, and they may end up dying once they lose too much blood. And also it's contraindicated to people who are high risk on breathing in the brain, such organs such as the brain, abdomen, chest, and the spinal injuries. Because if you are bleeding on these organs, very sensitive organs, you may actually end up dying. So So that's the story about that. Again, we have what they call the second line kind of, therapy to thrombosis. This is not a drug therapy. It's a non-drug therapy called mechanical prophylaxis. Okay, the first one is called cuff compressors. As you can see on the picture below, on the left side, the patient's legs are wrapped into what we call cuff compressors, and these cuff compressors are connected to a pump. As you can see, that pump is a hang to the bed. The pump basically will pump in some air into those cuffs compressors and compressing the cuffs or the cuffs on your legs. What that does basically is to increase the blood velocity within the legs. Once it compresses, and the blood velocity is going to increase. As the blood velocity increases, it actually dilutes, it actually melts the clots, because clots usually are melted by high velocity blood flow. And basically it's a very simple procedure. In the same way, we also have what they call anti-thromboembolism stockings. These are like normal stockings, but can go up to the thighs. Once you wear them, they've got a lot of elastics in them. Once you wear them, they compress your legs and actually putting a pressure on the veins and increasing the blood flow, the velocity of the blood flow. In that manner, the blood clots will melt and disappear. Okay. Another therapy involves the use of what is called inferior vena cava filter. And this filter can only be used, for example, if drugs are not, are contraindicated, or if you have what is called spinal cord injury or pelvic fracture present. So what happens basically is that if you can't use drugs, and this patient cannot take drugs at that moment, you can actually use this filter. You can see it's indicated on the picture below on your left. You can insert this filter in the inferior vena cava. These are veins, big veins. Once you insert it into a particular position, it's going to trap the clots. Once it traps the clots, at that position, the blood movement, because the blood in that area of the veins quite often is very high. And as the blood velocity passes through those, filter which is holding these clots, the clots will eventually melt down and disappear. Yeah, so basically that's it. And here is a scan photo output of a patient who's been inserted with a filter. You can see right in the middle there, and there's a blown up picture on the right indicating the filter inserted in the vena cava, inferior vena cava. Okay, and also it's important to mention that there are other technologies that one can use to prevent trauma. Yes, so not only surgical methods, but you can also have, for example, public health practices. For example, road safety enforcement initiatives, such as in South Africa you have Arrive Alive initiative or advocacy that helps to educate motorists to drive safely, to avoid drinking when they are driving, to avoid texting when they are driving, and also to obey road safety rules, because majority of the trauma cases are as a result of road accidents. And so you can see in this graph which you can read at home in detail, but it just basically it tells you the effects of such kind of initiatives, road safety initiatives that have been introduced over time and its impact on reducing the trauma cases as a result of road safety accidents. So you can see the impact of such, with the reduced, trauma cases and introduced at any given point, which means it requires a lot of monitoring of trauma cases at the hospital, taking stats at the hospital, how many trauma cases are reported, and analyzing that data. What is the major source of these trauma cases? If it's from road accidents, what measures can we employ? How can we prevent such kind of road cases? I'm giving this lecture now during the Easter break, and one of the important initiatives in the Easter break, the major message to people going on the Easter break is to take care of themselves on the road, because many of people are actually on the road driving to various holiday, sites, and this quite often results into many road accidents, and people need to take care. So with this kind of initiatives, if people are well educated, they take care of themselves, it can reduce the number of trauma cases. Okay, having said that, that brings me to the end of this lecture. And I wish you all a happy Easter. Take care of yourselves on the road. Don't drink and drive. Don't text and drive. And be sober most of the time. God bless you. Bye.